Hello, this is my comparative health problems project. I am Josie Post, and I will be going through my presentation. So the topic I have chosen to cover is depression, and the countries I'm doing is the United States, and then for my developed country, I'll be doing Sweden, and for the developing country, I'll do Costa Rica. So depression. Depression is a mood disorder that causes persistent feeling of sadness and loss of interest, also called major depressive disorder or clinical depression. It affects how you think, feel, and behave and can lead to a variety of emotional and physical problems. So some symptoms include feelings of sadness, hopelessness, emptiness, angry outbursts, irritability, frustration, loss of interest or pleasure in normal activities, tiredness, lack of sleep. Treatments are medication, psychotherapy, hospital or residential treatment. So the U.S. health system, as we've talked about in our lecture, follows a quad model with financing, insurance delivery, and payment as the focuses. The federal government funds some programs such as Medicaid or Medicare. U.S. health stats, so the life expectancy in 2021 was 76.4. The infant mortality rate was 5.1, and the health expenditure was 17.36%, which is the percentage of the GDP that's spent on healthcare. So in Sweden has a universal health system, so the government pays for everything, all healthcare. It's nationally regulated, locally administrated, it's funded through taxes, and it covers most services. So their expectancy is 82.7, so it's higher than the US. The infant mortality rate is 2.3, and the health expenditure is 11.25%. So the Costa Rica health system, it's also a universal health system. It's called the CAHA system. It has 100% coverage for all services, and it's funded through small monthly payments made by each citizen, and it's considered one of the best health systems in the world. The life expectancy is 78.6, slightly higher than the US. The infant mortality rate is 6.7, and the health expenditure is 7.57, so the smallest of all three so far. Depression rates in America, so about 8% of US adults suffer from major depressive disorder, 15% of US adolescents suffer, only 35% of those suffering seek help, and Americans spend $225 billion annually on mental health care. So some suicide rates in America, over 49,000 people died by suicide in 2023, which is one death every 11 minutes. And you can see a little bit more of the statistics. So depression rates in Sweden, 9 out of 10 citizens report having good mental health, but 1 in 5 report being diagnosed with depression, which is interesting. And there's over 1,200 suicides reported each year, so a lot less than the US. In Costa Rica, an estimated 4.4% of the population were depressed in 2021, and there were 8.06 suicides per 100,000 people in 2021, which was a 26.7 percent increase from 2020. So US depression, so how they deal with it, there's federal laws and regulations that aim to provide insurance coverage for mental health treatment. They're expanding telehealth use, and the CDC has a mental health strategy that promotes well-being and increases access to support. So in Sweden, they have a national policy to reduce suicide, and that provides guidework to improve mental health for the next 10 years. Also, every 4 years, students aged 11, 13, and 15 fill out a survey on their mental health. In Costa Rica, all mental health expenses are covered by the CAHA system. They have a national mental health policy that focuses on suicide prevention through education, early intervention, and mental health promotion. They also have a three-tier network. So let's compare. So Sweden and Costa Rica both are universal. The US is private and public. So Sweden and Costa Rica have higher life expectancies, less health expenditures. Their government pays for healthcare, and they have lower depression and suicide rates than the US. Sweden and Costa Rica consider mental health a primary care, so their government pays for it. All three countries have lack of access, though. So Sweden is wait times, US is affordability, and Costa Rica is provider shortages. Um, Let me go back. So Sweden and Costa Rica promote prevention and early intervention, and the US is starting to do that as well. Sweden offers early screening, which is the survey that the students take. US offers telehealth, and Costa Rica has community-based prevention efforts. So those are the three different things that each country is doing to focus on the issue, which you can see they're all different. And so it will be interesting to see how the US can take kind of advice from the other countries or like see what they're doing to try to lower our rates of depression. And thank you. That was my comparative health problems project. I covered the US, Sweden, Costa Rica, and depression was my